My name is Andrea Reyes. I am a cancer education specialist from the Columbia University Herbert Irving Comprehensive Cancer Center. One of our main missions is to get scientific and cancer information out of our institution and into the community. We're going to talk about HPV and cervical cancer and cancer screening. We're going to start with HPV. HPV can lead to cervical cancer. It is a sexually transmitted virus transferred through tiny invisible breaks in the skin during unprotected sex. You can have this virus and not know it because it is largely asymptomatic. No symptoms. You can develop symptoms years after you have sex. It can lie dormant in people's bodies. Then you can test positive many years later. It is the most common cause of cervical cancer. And the way that women get checked with it is yearly with a pap smear. There are no checks for men, unfortunately. Scientists have not been able to develop a reliable way to examine it. So HPV, about 90% of people get it who have sexual relations, get it at some point. Most of the time you clear it. Some people's immune systems cannot. So if someone gets it, you just want to make sure that you get tested regularly so that you are informed. People of all genders are at risk. Most who are infected don't have symptoms and feel fine. I would like to add here that there are over 150 variations. So we've heard the word variants in the news a lot. So HPV has different types and they are given numbers. So HPV 9 is very different from HPV 18 because the 18, we know that when people have that variant, you have a highly increased chance of getting cervical dysplasia, which is when the cells start to change on the cervix, which can lead to cervical cancer or vaginal cancer or vulvar cancer. You can also get it in your mouth and throat. There are variants of the HPV that give people genital warts. So when someone has genital warts, it may not necessarily mean that they have the type of HPV that can cause cancer. However, people can be infected with more than one variant. They can be infected repeatedly with different ones. Doctors kind of assume that people have it when they come in because 90% of people at some point are infected in their lives. So how does HPV cause cancer? Usually HPV leaves your body and you never know you had it, except that it takes 1 to 3 years for it to leave your body. But sometimes in some people, HPV does not leave the body naturally, and there's no medication for it either. The longer somebody has HPV infection, the more likely it is for abnormal cells to develop. And if untreated over many years, these cells can develop into cancer. So if a woman has cells on her cervix that are starting to change, it can take months or it can take 10 years for those to turn to be cancerous. While we are talking about cancer, I think it's really important for us to have a mental definition of what it is. It's not just one thing. Cancer is an umbrella term given to a series of diseases where the cell's inner machinery is damaged. The way cancer happens, it always starts in normal, healthy cells, and something comes and changes the way the cell works. So in this case, when we're talking about HPV, it is a virus that can change cells to make them cancerous. So the virus comes in, damages the cell in such a way that the immune system doesn't recognize that it's that damaged, doesn't kill the cell that's damaged. Typically it does. It starts to change the cell in a way where that cell starts to replicate out of control. It doesn't die, but it makes lots of copies of itself. So once you have a significant group of these copied cells that are damaged and can invade tissues and damage them, that's what cancer is. Damaged cells that replicate, copy themselves, and then invade tissues and can lead to some severe illness. There are complications when one has both HIV and cervical cancer or HPV. For people that have a healthy immune system, it could take between 50 and 20 years for cervical cancer to develop if they were exposed to HPV, the types that lead to cervical cancer. But if somebody lives with a weakened immune system, for example, like with HIV, the process may speed up. Those cells can turn in just 5 to 10 years. And because HIV weakens somebody's immune system, it's harder for the HPV infection to clear up in time and on its own. There's a higher chance for faster cancer growth in someone with a weakened immune system. There's a higher chance that the cancer cells don't shrink, and it's more likely for cancer to come back after treatment. If this happens, you're at a higher risk to develop abnormal precancerous cells called cervical intraepithelial neoplasia. They call it CIN. This is 4 to 5 times more common in people with HIV, and if this CIN is left untreated, it can progress to become cervical cancer. And if you have HPV, you're twice as likely to get HIV. Now, it's not like you can take an antibiotic or a pill to get rid of the cells in the cervix that are changing. These cells have to be removed, and the doctors have different ways to remove the cells, but it's not like you can pop a medicine or anything like that. So HPV-related cancers occur in both men and women in different parts of the bodies. The HPV virus really likes soft mucus and wet tissues like your mouth and your throat because they're wet and they're warm and they're moist, and it makes it easy for the HPV virus to start to invade the cells there. So nearly 100% of cervical cancers are caused by HPV, 75% of vaginal cancers, 70% of vulvar cancers, 60% of cancers of the penis, 90% of anal cancers, and 70% of mouth and throat cancer. These are really huge numbers, all from this little virus. Like I said, almost all cases of cervical cancer are caused by HPV. The types of HPV that they labeled 16 and 18 are way more likely to cause cancer than other types. And people get diagnosed at all ages, but most are diagnosed at an older age at about 50. And not of HPV, of cervical dysplasia or cervical cancer. And people are diagnosed older just because they're older. They've had the virus for a longer time in their body, and the cells have had more time to change, to mutate and become cancerous. Head and neck cancers, it's called in the hospital. Really, it's throat and pharynx and tongue and gums and cheeks cancer, but that falls under head and neck. There are lots of cases annually in the USA, about 20,000 cases. This head and neck cancer has surpassed cervical cancer as the most common HPV-related cancer. These rates have also doubled in the last 30 years, so there's a lot of HPV going around and a lot in people's mouths and throats. There's no screening tests for the mouth and throat, but sometimes somebody will see a lesion in their mouth, a bump, maybe it looks like a wart, maybe it looks like you bit your cheek and then the bite mark never went away. So whenever there's something in someone's mouth that's just different, or a bump or a lump, or you see like a white patch, you want to make sure that you get to a doctor right away. And there are dentists that specialize in HPV diagnosis. So they would then biopsy it and make sure that it is or not HPV that is causing whatever is going on in a person's mouth. The HPV test is done during a pap smear. There are 7 that are the most responsible for HPV-related cancers, and doctor can let you know what that is. The test doesn't check for cancer. The HPV test, it just checks for tumor DNA. It just checks for the presence of the HPV and also checks for the presence of cells that might be changing. That's the PAP. So, like I said before, there are no approved tests to find HPV-related caused cell changes or infections in any part of the body other than on the cervix. Hopefully in the future, there's a swab maybe that they can put into the mouth or on the penis or on a wart, but right now it just doesn't exist. There's nothing reliable that exists other than the pap smear HPV test. For anyone of age, it's important that you can get the HPV vaccination. Unfortunately, the vaccination has found to be ineffective in older people only because they've probably been exposed multiple times to HPV already. But it does work for younger people. So if you have young people in your lives, people can get the vaccine that will prevent nearly 100% of cervical cancers and penile cancers in men and women. It's recommended that you get the vaccine between age 9 and 11. It's not too late to get at age 15 or 20, and you can go up to age 45 and get the vaccine. And it's not recommended for people older than 45 because, like I said, you've probably been exposed and it's just not going to really work. Between age 26 and 45, some insurance will give you something for it, but otherwise there's like a $200 copay. But the benefits outweigh the risk. If you can do it, then you can get your HPV vaccination and not worry about cervical cancer. We talked about HPV and cervical cancer, and the takeaways from that are always get your pap smear, ask for the HPV test. If you haven't been getting it, it's just an extra swab during the pap smear. See what your records are. You always want to be informed. Now we're going to talk about cancer screenings that everyone should have. What are the checkups? At what age should you do them? What are they like? If you haven't had any, this explains to you what they're like. For those of you who have yet to have a mammogram, you start this at age 40. It's an x-ray of your breast. Multiple images are taken, multiple positions. The doctors look at the images on a big screen and they're looking for spots and dots that if there's something that they determine needs further checking into, then you would go and get a sonogram or an MRI of the breast. At worst case scenario, if a spot is particularly concerning, the doctors will take a biopsy, a needle biopsy of the spot. This is what the mammogram machine looks like. This is what the doctor sees down on the lower right, and in the lower left, that is what a tumor can present like in a breast. The reason that you're supposed to go every year is that the doctors want to take a baseline and then continue to compare any changes in breasts over time. Sometimes people get cysts, and the cysts, you want to keep an eye on it. The next year you go, did it get bigger? Did it disappear? Did it deflate? Different things can happen. The next cancer is colorectal cancer. So what is it? Like I explained, cancer before is uncontrolled cell growth. They replicate and then form a tumor. People typically get checked after age 45 unless they show symptoms of intestinal dysfunction or they have a family history of lots of polyps or colon cancer, because then you would go talk to your doctor and say, listen, this runs in my family. I want to get checked before age 45. And there are different ways to check. The best way to check is by having a colonoscopy. And what that means is that you're going to go under anesthesia for an hour, 2 hours, about an hour and a half, and a flexible cord is put into your intestine through the rectum, and the doctors look at every inch of your large intestine. That's also projected on a screen, and they just want to make sure that there's nothing in there that shouldn't be in there. There can be a lot of things in there. You can have an ulcer, you can have scar tissue, you can have a parasite, you can have polyps. Polyps are these little bumps that form on the lining of the intestine that can turn cancerous. Any polyps, the doctor will remove right then and there, and those go to the laboratory to get checked to make sure that they're not cancerous or precancerous. When you wake up, the doctor will tell you the findings and what happened, and you go home same day. It's a scary looking test, but you don't feel it because you're under anesthesia. Everyone that's also older than age 45 should be getting the little box that's on the left of the screen down here. This is called a fit kit, and it is a take-home stool test. You take it home, you go to the bathroom, you take some of your stool, and they give you brushes or a stick, and you put it on the card or in the little bottle, depending on what kit you're given. You wrap it up, it goes back to the laboratory. Any abnormal results, the doctor will let you know, and then you would be likely referred for colonoscopy. And what these tests look for, some of them look for tumor DNA, and others look for hidden blood in the stool. Colon cancer tends to make the intestine bleed. Sometimes a person can see it, but other times they're not seeing the blood cells because they're not visible and there's not enough. But these are two very good tests for colon cancer. Lung cancer, super important. You can get regular lung cancer screening if you have been a smoker, a heavy smoker. Your doctor will determine with you if you are eligible for a low-dose CT scan. With special X-ray equipment, you lie on a bed, they put you through the machine once or twice, it makes some noise and some clinking and clanking, and then your images are taken. This scan uses less radiation than a regular CT, so you want to make sure that is a low-dose CT scan, and they look at your lungs. So a picture on the right, this large white mass there, that's a lung tumor. The smaller ones could be tumors or nodules. People who smoke start to get nodules, which is like a little pimple almost, a little wart or something. It's a bump, and these bumps can turn into cancer. So this test is very important. Definitely people who smoke a pack a day for 15 to 20 years should get checked. If people have smoked lots of other things, just talk to your doctor and say, hey, do I qualify for a CT? This is my smoking history. Important to note that people with HIV or other illnesses that lower your immune function are at higher risk of lung cancer than people without. Another thing to talk to your doctor about. Screening for skin cancer. If you haven't gotten one, a lot of people don't know this. You can get, with no copay, a whole body scan every year. And I put this picture here on the right. This is what the doctor uses to look at every inch of your body. It's like a magnifying glass with a special light, and they go spot by spot to make sure that your spots, your sunspots, your freckles, your moles are not cancerous. Sometimes you might leave the dermatologist's office. They might say, you know what? I don't like the way this looks. It can turn on you easily. Let's just scoop it out. Other times you're fine. All depends on what your skin is looking like. People who have gotten a lot of sun in their life and not used sunscreen diligently and high SPF, if you've ever even gone tanning, you're at risk. So you want to make sure that you book your dermatology appointment. Here on the right, these are like the A, B, C, D, E's of melanoma. On the left column here, these are all normal moles. On the right, these are abnormal spots that are melanoma, which means skin cancer, and the most dangerous type at that. So the doctors are looking for to see if does it have symmetry or not. Asymmetry means it doesn't. So it's not a perfect circle. It's different on each side. In skin cancer, the borders are irregular. Sometimes it can be very inky black on the skin. Sometimes it has different colors. Sometimes it's raised. Sometimes it's just an odd shape. Sometimes the color has migrated to one side of the spot. Sometimes they're tiny. So just things to keep in mind. If you have any spots that could be concerning, don't worry, but definitely have a professional check out the spots. Sometimes someone can get it in areas that they didn't ever get sun in. So what you're looking for are spots that just look different, and have your doctor check them out. Liver cancer screening is something else that's important. When you go to the doctor and you have a general checkup, liver enzymes are often checked. If someone has drank a lot of alcohol in their life, if they have hepatitis B or C, they should definitely be getting liver checkups regularly. This is where your liver is situated in your body, and we know that it is the filter for everything that you drink and eat. It filters your blood. There is a hepatitis B vaccine, and it's never too late to get that. And for people with hepatitis C, there is no vaccine, but you can get treated, and some people can actually get cured. How are screening tests done? They do an ultrasound of your liver and blood tests, and then if anything is not normal, they'll ask for additional tests. It might be a CT scan or an MRI or whatever the doctor determines needs to be done to diagnose you or to make sure that you're all clear. Anal cancer is really important. This is just the doctor holding up a model of it, and it just bumps in the rectum. People with HIV have a higher risk of anal cancer than people without HIV. The federal guidelines recommend that all adults with HIV be assessed at least once per year for anal abnormalities, whether it's pain, burning, or masses, and undergo an exam as well. Also, during a colonoscopy, the rectum is checked. But if you don't have one, then this is just another way to go. Guidelines for men and women: to sum up, by age 21, women should all begin Pap screening, add the HPV test by age 30, mammogram at age 40, age 45, begin the colorectal cancer screening, and for men, age 45, the colorectal cancer screening, and 50, they should discuss prostate with their doctor. Of course, all adults should have the yearly skin cancer screening. There are ways that we might be able to stop cancer from occurring. At least 20% is lifestyle. Lifestyle means it's what you do and how you live that can lead someone to cancer. So number one, always go to the doctor. If you feel something, just go and make sure that at the age that you need to be getting the cancer screenings that you're getting them. You want to avoid all tobacco and smoke products because those are two of the leading causes of different types of cancers. We want to think about our environmental health. So if we're putting chemicals at home to clean our house, do we need those chemicals? Are they necessary? Can we make do with less? If we're using chemicals, Clorox, Lysol, spraying it everywhere, can we open windows? You want to always think, how can I reduce my exposure to chemicals? Because that can lead to cancer. It can mess up your hormonal system. This includes makeup and body creams and shampoos. So try to buy the all natural products so that the body products that you are using, you don't mess with your immune system and your hormonal system. Sunscreen every day to avoid skin cancer. I talked about vaccinations for hepatitis B and for HPV. If you're eligible, you want to make sure you have a good diet. That is critical. It is true what they say, you are what you eat. You want to limit fats. You want to always have half of your plate be fruits and vegetables. Always, always. When you serve yourself, when you have breakfast, lunch, or dinner, half of that plate should be fresh produce or cooked or steamed or whatever, however way you like to eat it, but it should be produce. Things with artificial color, artificial flavors, food that comes in boxes, candy, anything that's like not farm fresh. Again, that's going to mess with systemically completely, and you want to make sure that you eat as naturally as possible. And if your body allows it, you want to make sure that you get 20 minutes minimum of exercise per day. That's really important. Even if it means if you don't feel well, just sit in a chair, do some arm rotations, stretch as best as you can, even if you're lying in your bed. Do deep breathing, meditate. You want to do mindfulness, but you want to de-stress, but also make sure that you can get your heart beating every single day because that exercise is so important. So you can do this. We want to make sure that we stop cancer and other chronic diseases. You get your medical care, you go to regular screenings. You want to make sure you focus on prevention as well. And you want to make sure that you live a healthy lifestyle. Any cancer or chronic disease that a relative like your parents or grandparents or aunts or siblings have, you always want to report that to your doctor. So-and-so has this. Do I need extra testing? And they're going to know what runs in family strong, what doesn't. They might say, hey, get genetic testing, see if you have the genes for it. And that's just done with the tube of blood. And it's fairly simple. And you see a genetic counselor and they're going to let you know, look, you're perfectly fine and you don't have any genetics that you can pass down to people or that can cause you harm. Or they'll let you know, hey, you might be at increased risk for such and such because you have these genes.
Just make sure you're always telling your primary care doctor, your medical provider, all of those related. That's why they ask for family history, but keep them updated on that.